Welcome to week 9 of Nursing 301. This week we're going to cover chapter 73, which is the care of the school-age child or adolescents. We only have this chapter, and then we have chapter 74 is our last chapter for this term. So what is pediatric nursing? Older school-age children and adolescents often feel uncomfortable in healthcare settings in which most clients are young children. So healthcare personnel, we have to make every effort to provide a comfortable atmosphere for older children. Communicable diseases is what we're going to cover next. We have airborne, blood and body fluids, and direct contact. Of course, they can be spread by airborne, blood and body fluids, and direct contact. What are communicable diseases? They're a group of diseases spread from one person to another, and in many circumstances from animal to person. They're also known as infectious or contagious diseases. Communicable diseases by vector. It can be caused by or involve a vector, which is a living agent such as a flea or a tick or mosquito, which indirectly transmits an infection. Fomite, which is non-living, for example, a doorknob, a restaurant menu, a toy pen, which directly transmits a pathogen to a person. We have hospital-acquired infections, which involve direct contamination by way of a fomite, such as a faucet, bedding, stethoscopes. Zoonotic diseases are caused by viruses, bacteria, parasites, fungi, and are passed from animals to humans. Pandemics are countrywide and global disease epidemics. Many diseases are on a mandatory report list, which requires a healthcare physician to notify specific regional, state, or federal agencies of the suspicion or confirmation of a disease within a specific time frame of hours to days. Some must be immediately reported by telephone. Others can be reported by email or fax. The common cold. The common cold differs from the flu by the intensity of symptoms and severity of illness. Antibiotics are not recommended, and it lasts about 14 days. The common cold is a viral infection, which includes more than 200 known viruses. Rhinorrhea is one of the symptoms of a common cold. Or you can have sneezing, a sore throat, mild fever, coughing, malaise, headache, watery eyes. A sore throat can be caused by bacteria or virus. It's identified by pain, inflammation, or infection. A sore throat can make swallowing painful and your throat's very dry. Your throat can feel scratchy. However, if you have excessive drooling, it may indicate there is an emergency because it may indicate that the esophagus is swollen or the trachea is blocked. So just remember, if someone has really excessive drooling, and they have like a common cold, that may indicate an emergency, especially if they have a sore throat, because it can indicate that maybe either the esophagus is swollen or the trachea is blocked. How do we treat the common cold? We treat it with throat lozenges, antipyretics, and warm fluids. Conjunctivitis. Conjunctivitis is common in all age groups. It's pink eye. Symptoms is tearing, itching, redness, and a gritty feeling. Bacterial and viral are highly contagious. Bacterial, they'll treat it with topical ointments or eye drops, antibiotic eye drops. Viral is caused by a member of the adenovirus family. It could be Conjunctivitis could be related to allergies. It could be seasonal, and they treat it with over-the-counter eye drops. Giant papillary conjunctivitis is a severe allergic conjunctivitis result of chronic use of contact lenses. Treatment is they discontinue the contact lenses and use prescription eyeglasses. Treatment for conjunctivitis is urgent if you have eye pain, light sensitivity, or blurred vision. Glasses worn the entire time of the infection. If you have conjunctivitis and wear contacts, you must wear glasses worn the entire time of the infection. And remember, never use mouth saliva on contact lenses. I know you guys are going, ew, gross. But I have seen people pop their contact lens out, wet it on their tongue, and pop it back in their eye. So just remember, never use mouth saliva on contact lenses. Acute infectious mononucleosis. It is often referred to as a kissing disease. It can be acute or chronic. It is a member of the herpes virus family. It's an infection of the Epstein-Barr virus, or EBV. May cause hepatitis and enlargement of spleen. It's transmitted by droplets, most commonly in saliva, coughs, and sneezes, and by direct contact with mucous membranes. Signs and symptoms could be a headache, low-grade fever, anorexia, cervical lymphadenopathy, and a sore throat. Treatment is symptomatic, rest, fluids, and analgesics. Antibiotics if they're diagnosed with strep throat. They may also use corticosteroids. Remember, with mononucleosis, you want to avoid physical activity, such as contact sports, as severe hemorrhage and death are possible if the enlarged spleen ruptures. Remember, with mononucleosis, you want to avoid physical activity, such as contact sports, as severe hemorrhage and death are possible if the enlarged spleen ruptures. This is on page 1238, underneath treatment, on the left-hand side. It said the greatest risk of rupture of the spleen occurs during the first 2 to 4 weeks. And that concept mastery alert on page 1238, when caring for a client with infectious mononucleosis, the nurse should instruct the client to avoid strenuous exercise and contact sports, encourage the client to rest, and administer analgesics and measured doses of systemic steroids. Lyme disease. It is a zoonotic bacterial spirochete infection. It is a tick-borne bacterial illness. And signs and symptoms can be flu-like symptoms, fever, headache, fatigue, regional lymphadenopathy, some fatigue pain, joint and muscle pain. Aches can last 6 months or longer. Signs and symptoms may appear 3 to 31 days after the bite. An early characteristic skin rash called erythema migrans, which is a type of annular rash. It is a circular or oval lesion with a clear center, appears commonly around the original bite. It does not appear in all cases and may lead to delay of treatment. Prevention of Lyme disease, insect repellents. You want to check for the presence of ticks, washing outdoor clothes, wear long sleeves and long pants tucked into socks or boots, and wear light-colored clothing. Nursing, what can we do? We can educate regarding preventative measures. Long-term, it's referred to as chronic Lyme disease or post-treatment Lyme disease, etiology unknown. Untreated Lyme disease can cause serious problems. Arthritis can develop. It can cause damage to the heart, which can result with angina, which is conduction abnormalities, and Bell's palsy. And this is on page 1238, right column, the last two sentences of the first paragraph. Arthritis develops as a result of inflamed joints. Damage to the heart can result in conduction abnormalities, so they may have angina or angina, whichever way you want to say it, and Bell's palsy, which is an example of difficulties related to the nervous system. They treat it with 2 to 4 weeks of antibiotics. And I'm going to tell you guys, for testing purposes only, use tweezers to grasp the tick at the head and pull straight out without crushing. So that is on page 1239 in the box 73-1. To remove tick, use tweezers, grasp the tick at its head, and slowly pull it straight out without crushing its body. So that is for testing purposes only. Skin disorders, acne vulgaris. This is on page 1238, 1239. It is very common chronic skin disease of the hair follicles, seen on the face, chest, and back. Causes: it could be genetics, age, pressure on the skin, could be related to cosmetics, severe stress, some medications, cigarette smoking. Acne vulgaris, generally accepted that food does not cause acne, with the possible exception of milk and chocolate. So, generally accepted that food does not cause acne. Treatment is we want to keep the skin clean, avoid irritating the skin by using strong soaps or cleansers. And on page 1240, they talk about topical agents for acne vulgaris. Topical agents may cause bleaching of hair or clothing. Under nursing considerations, topical agents may cause bleaching of hair or clothing, and that is located on page 1240. The long-term goal of treatment is that they will have a decrease in lesions by their next visit. That is one of the goals, is they will have a decrease in lesions by their next visit. Infantigo. There's two types of infantigo. There's non-bolus infantigo and bolus infantigo. Most common bacterial infection in children 2 to 5 years of age. It is highly contagious. Touching and scratching the sores easily spreads the infection. Transmission is based precautions are necessary to prevent the spread of infection. Transmission-based precautions are necessary to prevent infection, to prevent the spread of infection. It's caused by staphylococci, streptococci, or mixed bacteria. Complications may occur if Staphylococcus aureus invades other parts of the body. Example, the heart, rheumatic fever, or the kidneys, glomerulonephritis. Treatment is antibiotics, topical, oral, or IV antibiotics. With infantigo, do not share towels, linens, or washcloths. It is, like I said, highly contagious. Good hand washing is essential. Clip fingernails short because fingernails have the tendency to harbor the bacteria. Tinea pedis, most common of the tinea fungal infections. Common fungal infection that attracts that attacks the skin between the toes, on the heels and palms, and between the fingers. Thrives in warm, moist areas. Athlete's foot, or ringworm of the foot. It is spread by contact with contaminated shoes, socks, or wet surfaces. It is caused by Candida albicans, and it can spread to fingernails, which can become thick, flaky, and discolored. Treatment consists of over-the-counter antifungal meds, such as powders or creams. And one of the things is you want to expose the feet to dry air when possible. With tinea pedis or athlete's foot, you want to expose the feet to dry air when possible. That is on page 1241. So for skin disorders on this page, you just want to remember acne vulgaris, topical and systemic medications can cause bleaching of hair or clothing. Topical medications can cause bleaching of hair or clothing, and the goal is to have a decrease in lesions by their next visit. Infantile, you don't want to share towels, linens, or washcloths. And for tinea pedis or athlete's feet, you want to expose the feet to dry air when possible. Musculoskeletal disorders, trauma. Trauma is a usually active, subject to many kinds of muscle and bones. Fractures and burns are types of trauma. Postural defects. Because trauma and the fracture, burns, chapter 77 discussed musculoskeletal disorders. And if I remember correctly, that was covered in first term. And then we move on to postural defects. Postural defects are often lifelong problems. Loneliness and isolation are common. Lordosis, or swayback, is an exaggerated inward curvature of the lumbar spine in which the pelvis tips forward. May be related to osteoporosis, obesity, associated with hip dislocations or contractures, and it is accompanied by pain. It may be idiopathic. Kyphosis is an abnormal curvature of the thoracic spine that results in a hunchback appearance. Related to diseases such as maybe TB, compression fractures, osteoarthritis, can be congenital. It can be related to abnormal vertebral development in utero, spina bifida. Postural kyphosis can be related to poor posture or slouching. And scoliosis is a lateral sideways curvature resulting in an S-shaped or C-shaped spinal appearance. It tends to be familial and is seen more frequently in girls than boys. Scoliosis can also result from injury, infection, or a birth defect. There are two types of scoliosis. There are functional and structural. So, treatment depends on the cause and severity of the postural defects. They may do medications, daily exercise, PT, and weight loss. There are different types of back braces that they may utilize. They have the Milwaukee brace, which extends from the pelvis to the base of the skull, and it covers the entire thorax. They have the Boston brace, which starts under the arm and extends through the thorax, lumbar, and sacral regions. The braces are individualized and regularly adjusted, and most typically are worn for most of the day and night, and may be worn for several years. Surgery may be needed to correct severe worsening or congenital curvatures. And then they also have, they also have the Harrington rod, which is actually secured to the vertebral bones following spinal fusion. The child's growth is arrested following rod implantation. They may require a cast or brace for immobilization, and the surgery is done only after more conservative treatment of the defect is unsuccessful. So the goal of all surgeries is to straighten and stabilize the curvature and relieve pain. Remember, loneliness and isolation are common sometimes with children with postural defects, because sometimes they are lifelong problems. We want to provide support for the parental caregivers, because we need to be able to provide support to them, because it is an important understanding for the needs of the client. And then we have juvenile rheumatoid arthritis, which is it's also called juvenile idiopathic arthritis, juvenile chronic arthritis. They are all arthritic diseases of the musculoskeletal system in persons younger than 17 years old. Juvenile rheumatoid arthritis is the most commonly identified condition, and etiology focuses on both heredity and environment. Symptoms, it could be, they can be persistent or intermittent. They can have painful joints, pain with movement. Swelling and stiffness are likely the primary suspects that lead caregivers to seek medical attention. Swelling typically appears first in the larger joints. Stiffness makes the child appear clumsier than usual, and they're unable to manage fine motor skills. How do we treat it? We treat it pain relief with NSAIDs or DMARDs to help prevent joint damage. We want to avoid infectious diseases, especially if they're taking DMARDs, because DMARDs and biologics have a potential to increase risk for infections by affecting the functioning of the immune system. And when they take DMARDs, it may take several months before noticing any beneficial effects. And like I said, it is very, very important to educate the client and the family caregivers regarding hand washing and the avoidance of infectious diseases, because both DMARDs and biologics have the potential to increase the risk for infections by affecting the functioning of the immune system. So, musculoskeletal disorders. Continued onto the next slide. Legg-Calvé-Perthes disease. It is a disease of one or both hips, affects boys 5 times more than girls, occurs in children 4 to 10 years of age. It results from lack of blood supply to hip joint, causing avascular necrosis or death of the joint. Cause is unknown. Signs and symptoms: they'll have painless limping, or they can have pain with walking. They'll have stiffness in the hip or groin area, upper leg and knee. Treatment is geared toward prevention of permanent hip deformities. Dental malocclusion is any degree of irregular contact of the teeth of the upper jaw with those of the lower jaw that causes problems with chewing, gum tissue, speech development, and cosmetic appearance. Causes can be genetic or environmental. Orthodontia is correction of tooth positioning and jaw deformities. Some may require surgery, but remember, the most important thing we can do is mouth care. Malignant bone tumors, osteogenic sarcoma. Malignant bone tumors are primary bone cancers. Osteogenic sarcoma is cancerous bone tumor commonly seen in young men, 10 to 30 years of age. Osteoblasts of the ends of the long bone are frequently involved, and it metastasizes by the circulation system. Symptoms vary. Excuse me. Symptoms vary: limping, sharp, dull pain, swelling. They'll have redness at the tumor site. Range of motion will be decreased. Treatment, how do they treat it, is biopsy, resection, amputation, chemoradiation. Aggressive treatment can reduce risk of death. Ewing sarcoma, and this is on page 1244, is a primary bone malignancy that arises from the bone marrow, and it affects the long and flat bones and occasionally muscles and tissues. It develops after birth and is not a genetically inherited disease, but it is a disorder of chromosomes. It's seen typically in children and young adults between the ages of 10 and 30, has no identifiable etiology. It can be cured in many cases, especially if it is discovered in its early stages. Symptoms resemble many other conditions, so therefore early accurate diagnosis is important. The most common signs are pain and swelling that gets progressively worse, occurring in the arm, leg, chest, back, or pelvis. Affected bones may have spontaneous fractures. Like I said, treatment, they treat with chemotherapy. It is intense and can continue for several months. They may do surgery and or radiation. Long-term monitoring is necessary to look for late signs of chemotherapy effects, such as impaired hearing or vision, growth and developmental difficulties, or development of problems with heart or respiratory systems. The respiratory system. Diabetes mellitus. Diabetes mellitus type 1 or insulin dependent. And then we have diabetes mellitus type 2 or non-insulin dependent. Type 1 is genetics, autoimmune factors. Type 2 most likely in overweight females. Risk factors is family history of obesity, diabetes, gestational diabetes, insulin resistance. Symptoms of diabetes, classic symptoms of diabetes: polyuria, polydipsia, and polyphagia. Polyuria is increased urine output. Polydipsia is increased abnormal thirst, and polyphagia is increased hunger. These symptoms are usually accompanied by weight loss or failure to gain weight and lack of energy. And most generally, you will see these with type 1, and it's accompanied by weight loss or failure to gain weight and lack of energy. So treatment, how are we going to treat it? First, stabilization of blood sugars with insulin. Adults need to learn the signs and symptoms of hypo and hyperglycemia and how to treat it. Infections must receive immediate medical care because they can lead to ketoacidosis. And then remember also that physical activity affects both dietary intake and insulin needs. So children that have been diagnosed with diabetes, especially adolescents, usually go through an adjustment phase in which they rebel against treatment. Adolescents often go through an adjustment phase in which they rebel against treatment. and that is on page 1245, kind of like in the middle of the page on the right-hand side. Adolescents usually go through an adjustment phase in which they rebel against treatment. And educational-wise, what can we do as nurses? We need to teach them the children need to eat regular and consistent meals. That children need to eat regular and consistent meals. And remember that polyuria, polydipsia, and polyphagia are symptoms. These symptoms are usually accompanied by weight loss or failure to gain weight and lack of energy. And then inflammatory bowel disease. It is an autoimmune reaction, most likely the cause. Long-term acute and chronic condition is Crohn's. It's a major inflammatory reaction of the uterus. Crohn's disease affects any part of the GI tract, mouth to anus. It attacks different areas of large and small intestine, leaving normal intestine between damaged area. Most commonly affected is the ileum, which is the last section of the small intestine and the colon. Crohn's disease affects the entire depth of the intestinal wall. Chronic ulcerative colitis is inflammation and ulcers of the lining of the colon and rectum, but does not affect the entire thickness of the wall of the large or small intestine. Most pronounced symptom is severe diarrhea. It can be debilitating or life-threatening. So treatment is palliative, over-the-counter, anti-inflammatory, anti-diarrheal, nutritional supplements, may have surgery to remove GI tract with fistulas, abscesses, or strictures. Nursing implications. With Crohn's disease, we have to provide good information and be very good listeners. Chronic ulcerative colitis, we want to provide support and educate regarding medications and side effects. And so, with both of them, we have to be very supportive, provide good information. And then just remember, treatment is palliative. It just all depends. They can use over-the-counter anti-inflammatories, anti-diarrheals. It just depends on what works for them. Reproductive system disorders. Menstrual difficulties include pain, delayed onset, discomfort, and altered patterns. We have Mittelschmerz. Mittelschmerz refers to one-sided pain, lower abdominal pain. So it's one-sided lower abdominal pain occurring during the time of ovulation. Dysmenorrhea is painful menstruation. We treat with NSAIDs. For dysmenorrhea, we have primary dysmenorrhea, which is PMS, which is cramping in lower abdomen just before or during menstruation. Secondary dysmenorrhea is pain caused by a disorder in a woman's reproductive organs. It could be related to endometriosis, which usually begins earlier in the menstrual cycle and lasts longer than common menstrual cramps. How are we going to treat it? We can administer NSAIDs, warm baths, relaxation techniques, oral contraceptives, emotional support, and anti-anxiety or antidepressant meds. Abnormal sexual development. Precocious, early, or delayed sexual development. We just want to provide, I can talk today. We want to just provide education regarding abnormal sexual development, and we also want to make sure that we provide informative, accurate information regarding sexually transmitted infections. Sleep deprivation and disorders. We have narcolepsy, which is a brief attack of irresistible sleep. It's rare and potentially dangerous. Hypersomnia. Hypersomnia is not in your book. Hypersomnia is not in your book. It is excessive sleepiness or drowsiness. Nightmares and somnambulism. Somnambulism is sleepwalking. It usually occurs often during later stages of non-REM sleep. Do not threaten or abruptly wake a sleepwalker. Nightmares usually occurs during REM sleep, where somnambulism usually occurs during later stages of the non-REM sleep. And with somnambulism, do not threaten or abruptly awaken a sleepwalker. Nightmares, they can often recall with vivid details. Night terrors or terror disorder. It is a sudden partial awakenings accompanied by significant emotional outbursts, screaming, panic, fear, and increased motor activity. Night terrors or terror disorder typically occurs in the first few hours after falling asleep, usually have no recall, and it rarely occurs with adults. And that is not in the book. Somniloquism. Somniloquism is talking during your sleep. It may or may not be associated with sleepwalking. Insomnia is difficulty falling asleep. It's related to hyperactivity or emotional disturbances. And sleep apnea. That is when a person stops breathing for short periods of time during regular sleep. Sleep apnea is when a person stops breathing for short periods of time during regular sleep. Narcolepsy, brief attacks of irresistible sleep, and somnambulism is sleepwalking. And somniloquism is talking during your sleep. So somnambulism is sleepwalking, somniloquism is talking during your sleep, and narcolepsy is a brief attack of irresistible sleep. Anorexia nervosa. With anorexia, it is a condition of severe, obsessive, self-imposed undernourishment, sometimes to the point of starvation and death. It interferes with health and growth. Anorexia can cause life-threatening bradycardia. Anorexia can also be, amenorrhea can also be a result of anorexia. But remember, anorexia can cause life-threatening bradycardia. With bulimia nervosa or bulimia, it is an eating disorder characterized by loss of control during overeating, followed by purging. And with bulimia, they can suffer from dental caries because of the purging, the stomach acids interacting with the tooth enamel, because it erodes the enamel from the front teeth and the throat, and it can cause throat irritation from the stomach's hydrochloric acid. They can have electrolyte imbalances, and even death are possible with bulimia nervosa or bulimia. Gorge purge eating disorder or binge eating disorders occurs when clients regularly eat too much food. A lack of control is the main concern, but unlike with anorexia or bulimia, the client does not follow eating with purging or exercise. And what is obesity? Obesity is having too much body fat, overweight, weighing too much, genetics. Treatment is to reduce body fat by weight loss. And obesity can increase the risk of lordosis developing. So obesity can increase the risk of lordosis developing. Anorexia nervosa can cause life-threatening bradycardia. Bulimia nervosa is characterized by the loss of control during overeating followed by purging. And obesity can increase your risk of lordosis developing. So, nursing considerations for nutrition. Middle childhood and adolescence are the time to put nutritional practices into effect. You want them to eat a nutritious breakfast. Teach them how to make good food choices. And of course, adolescents have an increased nutritional requirement. They have an increased need for protein and calcium. Iron intake is important, especially for girls. And like I said, teach them how to make good food choices. And with a diabetic child, their diet must be individualized. And obesity, it's hereditary. It can be hereditary. Peer pressure. It can inactivity, social-cultural influences, and psychological factors. And remember, education should always focus on ways good nutrition can promote improved appearance. That is the end of chapter 73. I'm just going to go back over a few things. Remember what I said about mononucleosis. You want to avoid physical activities such as contact sports, as severe hemorrhage and death are possible if the enlarged spleen ruptures. Lyme disease, if left untreated, can cause damage to the heart, such as angina and Bell's palsy. And for testing purposes, to remove a tick, you want to use tweezers, grasp the tick at the head, and pull straight out without crunching. For acne vulgaris, generally accepted food does not cause acne. Topical agents can cause bleaching of hair or clothing, and our goal is a decrease in lesions by the next visit. With infantigo, we don't want to share towels, linens, or washcloths. Washcloths, I should say. Kyphosis is hunchback. Kyphosis is hunchback, where lordosis is swayback. With the Legg-Calvé-Persse disease, that is a disease that affects one or both hips. It results from the lack of blood supply to the hip joint, causing avascular necrosis or death of the joint. And cause is unknown. With diabetes, you will have symptoms. You may have polyuria, polydipsia, and polyphagia. And those are accompanied by weight loss or failure to gain and lack of energy. Adolescents usually go through an adjustment phase in which they rebel against treatment. And as nurses, we want to teach the caregivers to provide regular, consistent meals. Retinitis pigmentosa can be associated with Usher syndrome, which is a specific hearing disorder in which retinitis pigmentosa and neural hearing loss are seen. Usher syndrome is most common cause of deaf blindness in the United States. Chronic ulcerative colitis, the most pronounced symptom is severe diarrhea. Narcolepsy is a brief attack of irresistible sleep. Somnambulism is sleepwalking. Somniloquism is talking during your sleep, and sleep apnea, you stop breathing for short periods of time. Anorexia nervosa can cause life-threatening bradycardia. Bulimia nervosa is characterized by the loss of control during overeating, followed by purging. And obesity can increase your risk of lordosis developing. That is the end of chapter 35.